So now a brief word about tumor markers. Here's a cancer cell. So tumor markers are proteins either on the surface, like receptors on these cancer cells that are unique to them, or products that are released from the cancer cells. And they do three main things. The first of which is they help confirm a diagnosis. So if we pick them up, we know that that cancer is around. Okay? So that's what they do. The second main thing is they monitor effectiveness of therapy. So here's a chemo drug being fed to this cancer cell, and if it kills it, then the tumor burden is going to drop, and we're going to know that that drug is working. Okay? And the third and final thing is if that tumor cell pops back up and recurs, we're going to know it because the tumor marker is going to increase. All right, so that's what tumor markers do. That's the purpose that they serve. Now, we're going to discuss particular tumor markers, and we're going to do this by quizzing you which cancers are associated with it. Ready? Yay, time for another game. So, the first one is prostate-specific antigen. PSA, what do you think? What cancer is associated with? Very easy. Prostate cancer, right? Yeah, okay, that was an easy one. All right, next one. CEA, carcinoembryonic antigen. It's non-specifically associated with what? GI malignancies like colorectal, pancreatic, and gastric cancer. Okay, good. Alpha fetoprotein. What about that one? Huh? Well, it's normally synthesized by, do you know where it's normally synthesized? The fetus, right? Wow, that's why it says feto, but it can be seen with hepatocellular carcinoma, and germ cell tumors of the testes and ovaries. Wow. What about beta HCG? This is, what is this basically? When do you test for this normally? For pregnancy, right? This is beta human chorionic gonadotropin, and it's normally released by the placenta. So, what type of cancers are associated with the placenta? How about a hyatidiform mole and choriocarcinomas? So too much placenta, when it gets out of control, that's when we see that. All right. How about the S100 antigen? When do we notice that? When we use that as a tumor marker. Melanoma and other cells that are derived from neural crest. So all the neural crest tumors, like melanomas, neural tumors, and schwannomas, are all derived from neural crest. How about alkaline phosphatase? Well, we normally see this where? What type of tissue? Bone, right? So this is elevated whenever there is increased bone degradation and turnover. Thus, we see it in metastasis. So here we see some metastasis to bone there. All these metastases are chewing up the bone and increasing the turnover cases, especially, I mean, in Bangladesh, they had an outbreak of arsenic where everyone was getting squamous cell carcinoma in the skin. But not only of the skin, if you inhale this, it actually can cause squamous cell of the lung too. And why would you inhale arsenic? I don't know why anyone would inhale arsenic, but millions and millions and billions of people do, probably, because that's how many people smoke. Arsenic is in cigarettes. It's in cigarette smoke, and that's why you get squamous cell carcinomas of the lung with cigarette smoke. Very bad. Not only of the lung, you get all kinds of cancers. I mean, smoking is the #1 cause of basically every type of death. Heart disease is associated with that, and all kinds of cancers. Squamous cell of the lung. You can even see it in this type of cancer. What does this look like? These OAT cells. Small cell carcinoma of the lung. You can see it in the kidneys and renal cell carcinoma of the lung, where it gets filtered in the kidneys, and even further down the line, the bladder. Now this time, it's not squamous cell of the bladder. This is actually transitional cell cancer of the bladder, okay? So, smoking is the most common cause of cancer and death in the United States. Very commonly tested. No, smoking is bad, okay? It's not very hard to know that, but just know it. All right, charcoal. Smoked meats and charcoal grills, especially in Japanese countries, are associated with what types of cancer? Gastric, the stomach, all right? There's toxins in the charcoal that actually can cause gastric cancer, and it's especially prevalent in Japan, so know that association. The boards likes associations. Here is some asbestos fibers. What do you know about asbestos? You see those commercials all the time. If you're exposed to asbestos, you're at risk of getting... I bet you were going to say mesothelioma, weren't you? No. The most common cancer is primary lung cancer. I tricked you on that one, didn't I? You walked right into it. So mesothelioma is the second most common, actually, but the most common is primary lung cancer. Here's mesothelioma. It's the icing on a cake cancer because it looks like the lung is surrounded by frosting, icing. All right, so if someone were to smoke and be exposed to asbestos, they have a dramatically increased or synergistic increased risk of developing cancer. And remember, most common is just primary lung cancer. They have a 90-fold increase. 90 times. So do not smoke and do not be exposed to asbestos if you can help it. All right, very, very good. Let's keep moving on here. So, continuing with carcinogens, let's talk about chemotherapy. So, here we see a chemotherapy drug. It's dripping from an IV bottle. Let's say that someone is on chemo for Hodgkin lymphoma, all right? So they already have cancer, they have a Hodgkin lymphoma, and they're getting treated. Well, do you know that certain types of chemotherapy can actually cause you to develop other types of cancer? It's terrible, right? They're actually at risk of getting another type of cancer, and that's, they have Hodgkin, they could get non-Hodgkin. That's awful. 2 types of cancer in one patient. Terrible. So, non-Hodgkin lymphomas or leukemias. And the mechanism is really the chemomeds alkylating with the DNA, inhibiting the cancer cell growth. And this can trigger, anytime, again, you mess with the DNA, you can run the risk of cancer. So, what other carcinogens are associated with leukemias? Now that we're talking about leukemias, how about radiation exposure, like from a nuclear power plant? Okay, that can cause cancer, that can cause leukemia. And what else? We talked about radiation causing, remember, those hydroxyl free radicals? Know this association? Papillary carcinoma of the thyroid. We already discussed that earlier.